I'm Dr. Tani Ping, consultant obstetrician and gynecologist, and today again is my weekly 9 p.m. live video on gynecological illnesses. Okay, so today I'm going to, as promised, I'm going to start a series of cancer prevention live videos, and I will start off with cervical cancer, which is the commonest gynecological cancer, and it is so often talked about, and you see it a lot in newspapers and advertisements now and then. So something that we already know for a long time, and we also know how to prevent for a long time. But still, until today, it is still the second highest gynae cancer in Malaysia. It's the second highest female cancer in Malaysia, not necessarily gynae. Because for gynae, it is still the commonest cancer for us, but in Malaysia, it is still the second commonest cancer in women. So despite knowing how to prevent for at least 30 to 50 years now, but still, it is still the second commonest cancer in Malaysian women today. Okay, let's start a bit about what is cervical cancer. Okay, first of all, do you all know where is cervical cancer? In Malay, we like to say cancer pangkal rahim. In Chinese, it's 子宫颈癌. So it's 宫颈癌. So do you all actually know where is the cervix? I'm going to show you a picture. Yes, this is a picture of the uterus, the tubes, the ovary, and that's the cervix. That's the cervix there, okay? So this is the cervix, this is the place, and this is the vagina. So when you have sex, the place where the penis and the uterus will meet usually will be at the cervix. That's where they bump with each other. And that is very important. I have a reason for why I want to explain that. That actually has a reason. So this is the cervix, okay? So that is cervix, that is cervical cancer. And a lot of people are actually very confused, you know. They're very confused whether it's cervical cancer, uterus cancer, because everything seems to be part of the uterus. Cervix is just the lower end of the uterus. You can see in the picture, it is the lower end of the uterus. So sometimes when they tell me, my mom have uterus cancer, I always have to ask, see, this is the uterus, and the cervix is just the lower end of the uterus. So a lot of people are very confused because it is linked to the uterus. In fact, yes, the cervix is connected to the uterus. So a lot of people, they thought they have uterus cancer, but maybe they have cervical cancer. And they think they have cervical cancer, but actually they have uterus cancer. Because partly it's not in English, because English is very clear. One is cervix, one is uterus. But in Chinese or Malay language, it's so close. It's 子宫癌 or 子宫颈癌, or in Malay it's cancer rahim or cancer pangkal rahim. So it's still the rahim. So everybody thought they have cancer rahim. So they're always very confused. They're very confused. So that is why sometimes when they tell us whether it's cervical cancer or uterus cancer, they always say it's uterus. But very often I still think it's cervix, because cervix is so much more common than uterus cancer. Okay? So once again, I just want to remind you that cervical cancer is the second most common female cancer after breast cancer. So after breast cancer is cervical cancer, number 2. So it is actually very common. Before I talk about cervical cancer prevention in more detail, I'd like to talk about the 2 types of prevention we always talk about. We have primary prevention and secondary prevention. Primary prevention means you totally prevent yourself from getting the cancer. The cancer won't come at all. That is primary prevention. Secondary prevention is actually the cancer is coming. It's coming. But because you knew it early, so fast you take precaution, fast you do treatment, and then the actual cancer didn't come. Because cancer don't happen overnight. If you start knowing more and more cancers, you will realize that cancer don't happen overnight. A lot of people tell you like as though it's overnight. Suddenly I went and checked and I have cancer. But actually, they never checked for so long already. So cancers don't happen overnight. It takes time to come, and usually it's for years. So it will be coming. That few years that is slowly coming, if you can detect early, you stop it, That is called secondary prevention. So you have primary prevention and you also have secondary prevention. So first of all, let's talk about why you get cervical cancer. Few factors. Number one, we know that cervical cancer is due to a virus called Hpv virus. Hpv virus, which is a short term for human papilloma virus. So cervical cancer is due to HPV virus. So first of all, you need to get HPV infection. You need to get this HPV virus infection. And if you see, just now I did tell you, the cervix is so deep in, right? That is the part where it will meet the penis when you have sex. So it's actually very deep in. For those of you who forgot, when you have sex from vagina go in, this is the part cervix. How do you think virus is going to reach such a deep structure inside? How do you think it's going to reach? Simple. It reaches because you have sex. So HPV virus infection is transmitted through sex. So if you have no sex, then there's no HPV virus and there's no cervical cancer. So simple, right? So first thing, you need to have HPV virus infection before you can get cervical cancer. That's the first criteria. Second, once you get the virus, does it turn into cancer straight? No, it takes many years, maybe 5 years to 10 years before it becomes cancer, depending on which HPV virus you get. There's so many HPV virus, almost 100 of them. So there's so many. So some are very much fiercer, turn into cancer faster, but faster also it probably will need 4, 5 or 6 years. Some are slower, maybe it will take like almost 10 years before it becomes cancer. So HPV virus, first thing, you must get the viral infection first. Number two, is your body able to get rid of the virus? So it's just like now, everybody talk about COVID-19. There are a bunch of people asymptomatic, they got well on their own. There's certain people, small percentage of patients will have very severe illness, end up in ICU for days and weeks. So what happens is whether your body can fight the virus or not. So if you can fight the virus, you'll be like those majority of those people who get COVID-19, they are asymptomatic, they have no problem and they are well, they got it, they don't know. They are well also, they don't know because nothing happened. So HPV also the same. If you have very strong immune system, you also can get rid of the HPV virus. So you get the virus and then you don't even know you got the virus, and then after you got rid of the virus already, and then you also don't know. That would be the best, isn't it? But unfortunately, certain group of women, they cannot get rid of the virus. So this virus stay in the cervix. We call about persistent infection. That means the virus is there for a long time. Long time is how long? Years. Many years, you still keep the virus inside you. So if you test for HPV virus and you detect the virus, this year you detect, next year you detect, another year you detect, every year you went and check your virus is still there, then of course your chances of getting cancer be very high. So why some women cannot get rid of the virus, some women can get rid? The first factor is age. Age. So that is why if we detect something in a young girl, like in her 20s, normally we tend to hold back a bit. We may not treat you immediately. We say, come back again in 3 months and 3 months and 3 months. And we hope that you got rid of the virus yourself. So if you can get rid of the virus yourself, then problem solved. Okay? The main factor, number one, is age. We know that girls, women in the early 20s, late teens, and hopefully also the late 20s, they most of the time, they can get rid of the virus themselves. But those in the 40s, 50s, very rarely they can get rid of the virus themselves. So 30s is somewhere, in between, depending on your own immune system. Then number two is, what are the other lifestyle that can cause the virus to persist? That means reduce your immune system. So what are the lifestyle things? Number one, cigarette smoking. We all know cigarette smoking is no good for our immune. That's why even in COVID-19, we know that cigarette smokers get it worse. So same, in cervical cancer also the same. That's why if the virus is there in your body, but if you are smoking, or maybe you're not smoking. I do see a bunch of women, they're not smokers, but someone around them is smoking. Their husband know, or their workplace. Maybe they work in certain environment, like some of the patients I have, they are clerks in a construction company. You know, a lot of construction bosses are all smoking. So everybody in her office is smoking, although she's a poor little clerk there, she's not smoking. But everyone else is smoking. So she is also at high risk because she is a passive smoker. Okay, smoking is one. Alcohol, if you drink a bit, of course it's fine. But if you drink a lot, also it will depress your immune system. And your lifestyle, like stress, sleep. Do you sleep enough? Or are you very stressful every day, working day and night? Do you get enough rest? Do you exercise? You know, all this also builds up your immune. Okay, so if you are not exercising, very stressful, don't sleep enough, then again your immune will be low, and then the virus will stay in your body longer. Okay, so studies have shown that actually 50%, that means about half of all Malaysian women, half of us would have had HPV viral infection one time at least in our lifetime. I told you there's so many HPV viruses, like probably nearly 100 of them, but we will only get at least one time one of the virus. Some of us may get 2, 3, 5, 10, but 50%, half of all women will get it at least once in their lifetime. But do you get half the population with cervical cancer? No, never, and never had it been. Even those days, long time ago, we don't have half the population with cervical cancer. No. Why? Because most of us will have an immune system to fight back the virus. So as long as you can fight back the virus, you won't get cervical cancer. Okay? So this is how you get cervical cancer. Then the next question is, how would you know you get cervical cancer? So there are two things. We want to know two things. Sometimes it's to be too late, right? By the time you know you have cervical cancer. We also want to know the early signs before we get the cancer. Before you get the cancer, are there signs? Rarely. Most women don't know. They don't know they have HPV infection. They do not know they have pre-cancer. They only know when cancer is already there, or going to be there very soon, or have already been there for quite some time. Because what are the signs? Number one, you have discharge with blood. You know, sometimes you have discharge and you see a little bit of blood. You see that little red line there. That is one. Or you see blood after having sex. You have sex with your husband, and then after that you see got blood. Either on the spot or the next day you see blood. Then you need to worry. And of course, the worst case is their discharge. A lot of discharge and very smelly. Very smelly vaginal discharge can also be a sign of cervical cancer. That's why I still remember when I was a doctor those days in government hospital, we used to have this gynae cancer ward. Oh, when you go into gynae cancer ward, there is always a stench. There is a smell. Because the cervical cancer women, they always have this smell because their discharge is very smelly. Okay? So these are the signs. But other than that, there are no way. And sometimes when you have these signs, you are probably almost getting the cancer or already having the cancer. So it's also a bit too late. Pre-cancer, that means way before you get the cancer. Are there any signs? No. There's no signs at all. Your discharge can be totally normal. Okay? So these are the signs of cervical cancer. So now let's talk about prevention. That's what I'm here to talk. How do you prevent cervical cancer? Two things you can do. Two things of prevention we want to cover. First, let's talk about primary prevention. Primary prevention means the cancer don't come at all. One you can do is, don't have sex though. Don't have sex for the rest of your life. No cervical cancer. So simple. So, good news for all the singles. Good news for all the singles. If you're single, then and you never have sex before, and you never have sex in the future, then you will never have cervical cancer because you will never have HPV infection. But there are also other ways of prevention. There is immunization. We already have Hpv Virus Immunization, which is already now available in school. All Form 1 girls will be getting the injection. It is under our government program. Everybody gets it for free. So if you have daughters going to school, remember when they are in Form 1, when the teacher asks you to sign for the HPV viral infection, a viral vaccine, please take the vaccine. For those of you who are no longer in school age, you can still take the vaccine. The age limit for vaccination is 45. 45, you know? Okay, there's a lot of stories that I hear. People say that once you're married, it's not effective, or you have reached a certain age, it's not effective. Or yes and no. Yes and no. We know that the vaccine, HPV vaccine, or some people call it as a cervical cancer vaccine, the effectiveness reduces with age. Yes, it reduces with age. But still, by 45 years old, it is still worth taking. Because it is the second commonest cancer in Malaysia women. It is the second commonest. It is so common. So even if it protects you by 50%, better than nothing. So that's why we still encourage women who are married to still take the vaccine. I also took my cervical cancer vaccine when I was in my late 30s. Okay, so I still take it because it is still protective. Half also still better than none because it is the second commonest cancer in Malaysia women. So for those of you who have not taken, please go and take. There are 3 doses altogether, and the newer generation of vaccine is covering more and more virus because I told you there's so many viruses, right? But the ones that are causing more cancer is only about 10 to 15 viruses only. And now our virus can cover until 9 viruses. We are covering more and more. So the newest generation of vaccine actually cover quite a lot already. Of course, it's still not 100% because the vaccine doesn't cover you 100%, and it also doesn't cover all the HPV virus. It covers mainly the stronger ones, the fiercer ones. Like just now I mentioned, some of the HPV virus can give you cancer in 3 to 5 years, but some can give you until 10 years. So the stronger ones that cover for 3, that can turn cancerous in a shorter period of time, they are all covered by the vaccine. So it is good to get the vaccine, okay? That is at least one way to prevent ourselves. And you just need to take this vaccine once in your lifetime, 3 doses in 6 months, 1 round only. So if your daughter took it in Form 1, that's what all she needs. She needs to take it only in Form 1, and that should keep her immunized for the rest of her life, okay? So primary prevention is 2. 1 is avoidance of all sexual intercourse. Number 2 is vaccination. And one thing, avoid sex here, not condom. Some people just use condom only. Condom doesn't protect you from HPV virus at all. Okay, I mean it does protect you up to a certain extent. Because how does HPV virus transmit? HPV virus transmit when one skin and another skin touch. So it's the skin of the penis touch the skin of the cervix, touch. So of course, if you wear a condom, nothing touched, it won't go through. But wearing condom in sexual intercourse, most of them, we only wear at the actual penetration. At the actual when you're going to ejaculate. On and off, you know, to be honest, I'm sure all of you who use condom, on and off, you do have penetration without condom. Maybe your husband just want to go in and out for a while before he ejaculate. So then he come out, then he put back the condom and then go back in. So if you go in and out just for a while even, but the skin of the penis and the skin of the cervix touch each other, then you can still transmit HPV virus. That is why we do not say that condom is protective. Condom is not 100% protective because it depends on how you use the condom. Okay? So, but even if condom is protective, you must understand HPV virus is skin to skin. So it's not just the penis and the cervix. It can actually cause cancer of the vagina and cancer of the outer part, our vulva, the outer part. So even if you wear condom, the outer part is not protected by the condom, so you can still get skin and skin exposure. So you can still get HPV infection. But of course, this is outer. It doesn't cause cervical cancer. Cervical cancer is inside, okay? But it can still cause vaginal cancer and vulvar cancer. Okay, so primary prevention, I've covered that. Then secondary prevention. How do we prevent getting cancer when the cancer is already coming? Already coming. And that is what we call Pap Smear Test. This test has been there for so many decades already. And for certain countries where the Pap smear coverage is good, near 100%. Near 100% of all the women in the country have Pap smear test done regularly. All these countries actually, mainly the developed countries, and actually they have shown like almost negligible number of cervical cancer. So if everybody do Pap smear regularly, then you won't have cervical cancer anymore. So when do you start doing Pap smear? 1 year after? 1 year after sexual intercourse. That is the key. 1 year after beginning of sexual intercourse. We don't care how old. We also don't care whether you're married or not. But in Malaysia, I think it's our country, we are very conservative. Whether you have sex before married or not, nobody's going to talk, right? So Malaysia policy is very funny. Malaysia policy is after you give birth, you must do after you give birth to your first baby, you must do Pap smear. That's how we usually start. The government clinic kesihatan do the Pap smear only after you give birth. So they are actually catching people after they give birth. That is based on presumption of one thing. Few things. One is you only have sex after you got married. And second presumption, you got pregnant immediately after you got married. Because you get pregnant immediately after you get married, by the time you give birth, and then after your confinement, then you do your Pap smear. Just nice. 1 year. But that's not the reality, isn't it? There are some people who have sex before they are married. And even if they are married, some people don't want to have baby. They will wait 1 year, 2 years, 3 years, then only they have babies. So that's why I do hear a lot of women will tell me that I heard that Pap smear only do after you give birth. Oh no, nothing to do with give birth. Pap smear must be done 1 year after you start having sexual intercourse. Okay? And for the first 3 years, you're supposed to do it every year. First 3 years, you do it every year. And then after that, if your first 3 years is totally normal, you can actually do it 3 years once after that. But that is again based on one presumption. Based on what presumption is that? That you do not get any new virus infection in the future. In a way, it's because most women get the HPV virus during their first year of exposure to sexual intercourse. But we know there's actually two peaks. The first peak is during the first year when you started having intercourse. Before you have intercourse, you definitely won't have HPV. So high chance is a lot of people actually get it the first year they have intercourse. So that is your first peak. But there's actually a second peak. And the second peak is usually in their 40s. 40s is another second peak. So, but then if you use that presumption, you may actually at the end miss out the 40s. Those days we didn't know about these 40s. We always presume it is the first year of marriage. Why? Also because we know that HPV virus, you get it from sexual intercourse. Then the question is, how come your husband have the HPV virus? Of course, the husband can have the HPV virus from various sources because we know that skin and skin exposed, you get it, right? So, husband penis is outside. If for some reason, somebody else who has a HPV virus touch his penis, he will get the virus. But the question is, who is touching? Why touch? Or maybe it's his own hand, maybe. Okay. Maybe he touched somebody with the virus and he touched himself again without washing his hand in between. Maybe, we don't know. So we never actually categorize HPV infection as a truly sexually transmitted disease because women get it from sex. Men, we cannot prove.
They can get it from anywhere. But mainly, they will still get it from sex with another woman. So why the second peak in the 40s? Because 40s is the peak age for promiscuity. Sad to say, most of us get married in your 20s, busy with your children in your 30s. 40s is when your husband look for someone else. Or women also look for some other man. I have to be fair. Every time I say that, my male colleagues will hantam me. Wait, what do you mean, man? You mean men only look for women outside? Women also can look for other men. Yes, true. And I think 40s is the age, the peak age of promiscuity. So that is the age a lot of men or a lot of women started having sex with more than one partner or another partner outside the marriage. And that is why they actually get a second peak of HPV virus in the 40s. So if you get HPV virus from the day you first time have sex in the first year, and after that, both you and your partner never have any more intercourse with any other partner anymore, the chances is you most likely will not get a new viral infection. That is why I can do my Pap smear 3 years once. But you never know. You can know whether you have sex with any other person or not, but you will never know if your partner have sex with any other partner or not. So, for example, I'd like to quote a few cases. I have this couple. This lady, she has cervical cancer. And then later she told me that the husband, she's the second wife. First wife also died already. First wife died of cervical cancer. Now she's the second wife. Now she also got cervical cancer. They never do Pap smear. I was like, oh my God, your husband have a wife with cervical cancer and yet he doesn't know you need to do Pap smear every year? So what happens is that this husband carried the virus from one wife to another wife. I have also seen husband and wife also getting cancer from HPV. You must understand that HPV can cause cancer for both men and women. Men get cancer of their penis. Women get cervical cancer. But there's one difference. Men's immune system is better than women in the sense that women, our uterus and cervix tend to be lower immune because we need to get pregnant. We need to let the sperm go in. If you have such a strong immune system in your cervix, you will also kill the sperm. So we need to let the sperm go in. We need to let the baby stay. So all these things actually, if the body misinterpret, may think that they are virus or bacteria, they kill the baby, kill the sperm. So we cannot let the immune system reach our cervix and uterus. So that is why our uterus and cervix, the immune system is not so good. But men, penis, their immune system is a lot better. So usually men don't get cancer, but except when they are older or when they are sick, like they may be having diabetes, smoking really a lot to the extreme, they also can get cancer. So I have seen husband and wife cancer, wife cervix, husband penis. So that's one example. So now back to the story about, can we believe that we will only get our viral infection during the first year, during our initial exposure to sexual intercourse? It's something to be on the safe side, because I have people have questioned me in the previous live video. Should I do Pap smear 3 years once or 1 year once? My general advice is every year, because you won't know when you have a new viral infection. Based on the normal program is 1 year once for 3 years. If you're totally well for 3 years, you can do it 3 years once for the rest of your life. But to be on the safe side, I will still do it every year. For example, recently I had one case. She had all the infections. Also in her 40s, and she had not just HPV, she also had the rest of the sexually transmitted illness. And she was just crying in front of me. She said, it's impossible. She just said, it's impossible and impossible and impossible. But the results are there in front of you. How? I don't know. She says it's impossible because she goes to work with her husband, she comes back with work from her husband. She goes to work with her husband, she comes back from the work with her husband. I cannot answer you. You must go and ask your husband. Okay? So sometimes we cannot presume lah. We cannot be presumed. Okay? Maybe I am a gynae, so I see more things. I see people with sexually transmitted illnesses almost every day. So that is why it's best not to assume that our husband will forever have us one as the only sexual partner. So be on the safe side, do your Pap smear every year. Until, when do we stop? We have a stop age actually. We always say 65. There are two reasons why we stop at 65. One thing is, we presume one thing again, that most women from the age of 55 onwards, once they menopause, because of vaginal dryness, they most likely will not have sex anymore. In fact, it's true. It lasts a lot of women like in their late 50s or early 60s, they'll tell you they don't have sex anymore. So if you really do not have sex for 10 years, from 55 until 65, and these 10 years your Pap smear is all normal, then 65 onwards, no need to do Pap smear already lah. No sex what? Do what? Because even if you get a viral infection, about 10 years you should have something in your Pap smear result already. If it's still normal, then no need lah. Okay? But what if you are still having sex? What if you're still having sex? Then I think if you want to be on the safe side, please continue to do after 65. Okay? And I have even heard a lot of women tell me the same story. Are you so old already lah? We hardly have sex. Wow. Just because they think they hardly have sex means they are safe from sexual transmitted illnesses. You know what I tell them? Because you hardly have sex, that is why you're more likely to get HPV infection. Why? Because when you hardly have sex, that is when your husband starts to have sex elsewhere. Okay? So, a lot of women think that because they hardly have sex when they are already in their late 50s and their 60s, they are safe. No. We see so many women in this age group with sexually transmitted diseases. So this is the time you will re-get your HPV infection. That's why you get cervical cancer in women in their 70s. Why do you think she get it in their 70s if they hardly have sex? So you can still get HPV infection and cervical cancer even in your 70s. So basically back to whether you still have intercourse. If you still have intercourse on and off in your 50s and 60s, better continue to do your Pap smear. Okay. But there's also another thing that we think about. There's another reason why we stop at 65. We feel that after 65, if you don't get cervical cancer, maybe you get breast cancer, maybe you get bowel cancer, colon cancer, stomach cancer, pancreas cancer. You avoid this cancer, you get another cancer. No need to Pap smear lah. Oh, that was the thinking that we had. But trust me, this thinking is 50 years old already. Why? Because people in the past, their lifespan is only about 70. So 65 to 70 is about time to go already. You don't get cervical cancer, you get something else. But nowadays, our lifespan has gone longer, you know. Malaysia lifespan, all 80s already, late 80s. Women out there, you must be prepared to live until at least 85. In fact, I would like to tell you 90. Why? Because lifespan is increasing with time. If you are now only 30, I think by the time you reach 80, women's lifespan in Malaysia is already 90 something already. So if you're going to buy a medical insurance, better buy 100 years old, okay? If you're only in 30 years old. If you're now 60, 70, maybe your lifespan is actually supposed to reach until 80 plus. But if you're only 30, 40, there's a possibility that by the time you reach 80, most people live until 90 plus already. So the question is, 65 enough? You know, you do your Pap smear until age 65, but you probably may live another 30 more years. So then back to whether you still have intercourse or not. If you have intercourse, then please continue to do your Pap smear. Even if you have intercourse once in a while. Once in a while is worse. Okay, it's worse actually. So, secondary prevention for cervical cancer is to do your Pap smear every year. Or there's another thing you can do. You can also do HPV test. If you do a Pap smear plus a HPV test, then yes, maybe you don't need to do every year. Maybe you can do 3 years once. Because HPV comes first, then abnormal Pap smear, then cancer. Okay? So this is how the progression works. HPV comes first, then abnormal Pap smear, then cancer. But also you need to depend on your lifestyle. Because I did mention about lifestyle, your immune, whether you are very highly stressed, whether you don't sleep well at night, you smoke a lot of cigarette, or your husband smokes a lot of cigarette in front of you. Because in this group of women, I noticed that actually they get cancer a lot faster. We have people that do Pap smear every year. Today they are abnormal, next year they are pre-cancer, another year they are cancer. But you go back and look at their life, usually highly stressed. So need to look at your life. If you are not stressed, sleeping well, enjoying life, having a good life, don't smoke, healthy lifestyle, every day go yoga, swimming, husband also healthy, don't smoke, then of course you not necessarily have to do it so frequent. You can do, if you do a HPV test plus a Pap smear, you can do it every 3 years once. Okay? But having said that, again, I will always still advise women to do, to regularly every year go and see your gynae, because you do notice that you go and see your gynae is not just for Pap smear. You go there, you get your breast examined, you get a breast ultrasound, you get a mammogram, you get your ultrasound of the uterus, you get an ultrasound of your ovaries, and in my next few lectures, I will talk to you about the other cancers as well. And soon you will realize that actually because you have so many things to do, it's not just Pap smear, it's better to do every year. Because when we talk about government program, when you go to government clinic, you only get a Pap smear done. Nobody checks your breast. Nobody does a mammogram or ultrasound of your breast. Nobody gets to scan your uterus. When you go for a Pap smear, you only go for a Pap smear. You want to go for mammogram, you have to go for mammogram only. So that is the case when you do things separately one by one, then of course, Pap smear, you can follow the government program. If you do it together with HPV, 3 years one is fine. Okay? So remember to prevent HPV cervical cancer. Number 1, if you never had sex at all in your entire life, you do not need to worry. If you have sex like for a certain period of time and you stop having sex already, maybe you're divorced or you've broken up with your partner, you still need to do your Pap smear every year for the next 10 years, okay? So that's number 1. If you have no sex, then you do not need to worry so much, but it's totally no sex before, or at least 10 years no sex, okay? Number 2, get your HPV vaccine if you have not gotten your vaccine. And number 3, do your Pap smear every year, okay? So if you have any question, please feel free to put it in the comment section now. I will try and answer your question. So some of you may wonder why I'm not covering breast cancer. Theoretically, breast cancer is not under our gynae. Okay, we don't treat breast cancer. We do examine breasts, we may scan breasts, we may send you for mammogram, but we don't treat breast cancer. Breast cancer is under breast surgeons, so I'm going to cover purely gynae cancer. So next week, I will probably cover the rest of the cancer, uterus, and another week probably ovarian cancer, okay? Actually, I have these seminars on prevention of female cancer regularly on and off in the past. Okay, everything is in the past. MCO, no seminar, no nothing. But I'm already having a lot of online seminars, and I've done a lot because I realized that if I'm going to have face-to-face, I can't reach a big crowd because there is a limit as to how many people we can reach nowadays with this COVID-19 thing. I don't think I can have big seminars that I used to have, like I can have hundreds of people in my event hall. Not likely going to do that. And another thing is, if I'm going to have small seminars, that I cannot reach out to a lot of people. So now actually I have a lot of online seminars running. Let's see what are the questions you have here. Okay. Yes, good evening, Ivory. Okay, so hi Shaza and Shireen. Shireen has a question here. Shireen asks, how much is the vaccine? Okay, there's many brands out there, but the latest version, which is Gardasil 9, because it covers 9 viruses. So you have vaccines that cover 2 virus, 4 virus, or 9 virus. Even the 2 virus is still not too bad. Why? Because actually, if you go to school, you're most likely going to get the 2 virus only, the school children. So that's why my daughter, even though she's in Form 1, school give her last year when she was in Form 1, the school gave her the vaccine, but I know they're going to give the 2 virus only. So I told school it's okay, you don't need to give her, I give her the 9 one. Why? It's because school only give 2, but it's okay lah, 2, because it covers the 2 strongest virus already. These 2 virus is very strong one. You get it very fast, cause cancer. The rest doesn't cause so long. Don't form cancer so long, it can last longer. So school cover the 2 strongest viruses of all. But for my own daughter, I rather pay and get her the 9 viruses one. So I told school, you don't need to do the vaccination for her. I will do it myself. So if you are going to get the newest one, which is 9 viruses, which is Gardasil 9, it is ranging between 1,400, 1,500 like that. For 3 doses, okay, it's 3 doses. So 1 dose maybe about 4, 5, around 500 like that, okay, around that price. So that is for 1 dose. So for 3 doses, then it can cost up to 1,400, 1,500. Norina Yusuf, yes, as I mentioned, highly stressed, smoking, exposed to smoke leads for all, in fact, all cancers, honestly. It is a risk factor for all cancer, so cervical cancer as well. So stress, smoking, sleep is also very important, okay? Joyce asked, can we take the vaccine even we are trying to get pregnant? Yes, the answer is yes, because this vaccine, they have done all their research on women, and you know lah, women, even though they say I'm not planning, there will still be some women in the research group that accidentally got pregnant one. And we know those women who got pregnant, even though they're in the research group those days when we were doing the research for HPV virus, they actually all had normal pregnancy and normal baby. So it's okay. But if you're pregnant, we wouldn't start the vaccine. Okay? If you're pregnant, we won't start the vaccine. But if you have started the vaccine, let's say 1 dose, 2 dose, and then you got pregnant, it's fine. The last dose, we just give it after you give birth. No big deal. Okay? Okay, Lillian Chop asked, hi doctor, is it true that we cannot get pregnant for a certain period after that vaccine? No. Okay, as I said that during the research they have done, and actually a lot of women actually conceive during that time. So no. So you can still have the vaccination while you're still planning for getting pregnant. But of course, the best time I always say to a lot of women, I mean, because I catch them usually during pregnancy. So during pregnancy, if you have not had your vaccine, then please do it after you give birth, okay? So for those of you who are younger, who are not married and who haven't had any children yet, but you know you haven't had this vaccine before, then please have it. Okay, because those days we don't have it in school. But I think we have this school program quite some time already, almost 10 years by now. So if you have left school for quite some time already, then it's better you take this jab. You will know this jab one because in Form 1, you actually take 3 jabs. I'm sure you remember it. Okay, so yeah, that's all the questions you have now. And if you have any other questions you want me to talk, you see, I also need suggestions from you actually, because I've already had this live video for so long already, since the beginning of MCO, so I started since March. So I also sometimes lost a topic to talk about already. I can think about the 2 more cancers that I'm going to talk about, and I'm going to talk a bit on fertility after that. But that's all. I don't have any other ideas. If you have any idea what you want me to talk about, please write it down in my comment section also. Okay, so please write it down in my comment section, or you can PM me personally to suggest to me what you think you want me to talk about. Okay, I will go through the topics and see whether it is something that we can actually talk about. You know, sometimes I know some of you put questions, but I'm like, what am I going to say? I mean, finish in like 5-10 minutes, then it's not so suitable lah. But if you can give me a topic that I can talk for at least half an hour, then of course it's suitable. So if you have anything you think you want to know more, anything, just write it down in my comment section. I will go through it and I'll see if there's something to talk about, that I will definitely talk. I really do hope that you'll help me to come up with topics as well. Okay? So that's all for tonight's live video. Do stay tuned for next week, Sunday, 9 p.m. Okay, thank you and bye-bye.